Good afternoon. My name is Edward Juhn, and it's really an honor for me to stand here and help wrap up today's conference. It gives me particular pleasure, mainly because a tradition of the Premier Healthcare Conference speaks about the present. Today, we've heard about the dynamic process of managed care and how it takes into account costs, access, and quality, and how these in turn drive and influence the clinical, the financial, and the organizational structures in healthcare. We've heard the current state of our industry, and we've also heard where we need to be. Everything that you've heard today is critical, but more importantly, what you put forward tomorrow with this knowledge is vital. I know that this may sound like a daunting task, but we can be assured that under the guidance and leadership from our keynote speakers and through their messages, that the road for managed care pertaining to those with developmental disabilities is on the right path. Today's Premier Healthcare Conference isn't just your run-in-the-mill, let's talk about managed care for a day type seminar. Rather, today's conference is about creating a national dialogue in order to establish a framework, a successful framework in which we deliver managed care to those with developmental disabilities. Every one of you in the audience today is uniquely positioned to help those with developmental disabilities access healthcare services. At its core, managed care will require a collaborative effort. We will need to fully integrate our consumers with the community and the support services available. In essence, managed care is complete healthcare. Managed care is quality healthcare. Managed care is cost-effective healthcare. Let us speak with our friends, colleagues, coworkers about all the conversations that we've heard today. And let us talk loudly, listen, and hear what they have to say over the next few days, weeks, and months, and listen and hear and address their questions, concern, and fears as we address our own. But no matter what these might be, let us bring all that back to why we are here today. We are here not only to speak for those with developmental disabilities, but with them as well. As you leave today's conference, remember not only the key points of cost-effective, quality, complete, integrative, innovative healthcare, but really become a catalyst for change. Utilize your personal strengths, your organizational strengths, and leverage them in a way that we can deliver managed care in a successful manner to improve the lives for those with developmental disabilities. We're going to need a system that we can believe in. We're going to need a system that needs to start today. On behalf of everyone and all the clinicians here at Premier Healthcare, thank you.
You know, I'm really struck by the intelligence and the high degree of qualification that all the speakers today have represented. And I'm here as a kind of living segue to the cocktail party. So the big brain parade is over. But I want to say that I'm really very moved to be here today because, you know, Margaret and Ellie and I and others here are sitting here and looking at all of this through the prism of being parents. And what that means is that we feel a kind of terror. My wife and I have had a joke that was most repeated at moments of vulnerability, usually in a doctor's office. And the joke was basically, we should have thought of this before we had a child with disabilities. Because when someone says, you know, I'm not sure how long you're going to have to wait, and you say, gee, you know, it's been 45 minutes, another 30 minutes for my son Tom is going to be a long time, and they say, the doctor's with the patient, I told you that before, and you think, right, neurotypical kid, this is not a big deal. Kid with complexities, it may be the beginning of a very difficult day. And one of the things that I find really moving about being at YI and working with Premier and with Marco and Peter and Edward is that they are absolutely committed and devoted to sort of somehow closing that circle. And listening here today to these people talking about in various ways, I'm first of all struck by the sincerity and the caring and the quality of thoughtful intelligence on behalf of all of you. I mean, you're talking about, when Dr. Sherman talks about elderly patients, he's talking about people who are a pain in the neck one by one when you think about it. And yet, if you approach these people, and, it's interesting, my mother-in-law is now quite demented and sort of becoming, frankly, difficult to handle. And yet my family has a compassion and an understanding with her because they know Tommy. And they've simply got used to the idea that people can be different, but interesting, charming, and if you sort of get through the embarrassment, the awkwardness, the differentness, the uncertainty, all the little things that you have to get used to, there are human beings there. And if you manage their complexities intelligently, you don't drown with all that. So the difference, the PACE system you described sounded extraordinarily elegant and beautiful to me, because what it did was it found a pathway through the kind of complexities that normally simply beggar systems and people's patience and people's ability to handle things. So the language we heard today was often quite clinical and technical, but what we're relying on all of you for, as if I can speak on behalf of parents, I've finally been allowed to do that for 10 minutes, so I can now speak pompously as a parent with a capital P. But what we're relying on you to do is to help us get through this transition from a world of what does he need, what does she need, which was New York State's kind of ruling paradigm for many, many years. I mean, I was very struck as a non-American originally, when someone said to me, we had started a program at Bank Street, and when my son graduated from there at the age of 4 or 5, it was unclear what he was going to do next. And someone said, come out to Westchester. And I said, why? And they said, because we got a great public school system. And Marinette has got a great system, and whatever he needs will be taken care of. And it took me a few meetings to grasp the idea that if your son has one leg and needs some mobility things, they'll work it out. If your son is a little bit slower to learn things, they'll figure out how to teach more slowly. If your daughter has trouble communicating, they'll try to figure out a way to help her. This was an extraordinary concept to me, and one I've never taken for granted. Nonetheless, we are now talking about a transition from a what does this person need paradigm to what can the system afford. This is very, very scary. And we're not scared because we're idiots. We're scared because this is frightening, and the potential for restrictions and for people being discharged to nursing homes and for various other kinds of extremely unattractive scenarios is real. So what I want to say to you is not so much what Marco and Peter asked me to do, which is to summarize. Who on earth could summarize a day like today? But to simply say that what I saw here was a group of highly intelligent people who really seem to understand these issues. Even an almost intelligible lawyer like Stephen Warnke, who can speak very, very lucidly about the details and the nuances of 5 different acronyms. You know, acronyms really are a problem of epidemic proportion in your field, but that's just a free observation. But what's really important is that if all of you people, I feel every time Stephen or anybody else at YI gets worried, I think like, no, you can't get worried. We're counting on you. So you represent something very important and special to us. You represent people smart enough, committed enough, and passionate enough to get this right. And if you don't, the private sector will rule. And I don't have a lot of faith in the private sector's ability to keep moral, social, and human considerations foremost. You know, if you look at how, I mean, walk around New York City, the buildings of the last 50 years have, the reason that we love the Lever Brothers building or the Seagram's building is that those buildings were built by people who actually cared about how the building would look, feel, and be experienced. They were usually very wealthy. Most buildings are built for maximum square footage, and by and large, in the context of the marketplace, there were 2 words that were not mentioned today. One was tea and the other one was party. One of the things that's going on in this country is that there are people who are arguing very vociferously, and they may well succeed in the next election in getting elected, that it's time to reverse a trend that began with FDR and the idea that there was a social net to catch people who fell. There are people who are saying, why? You don't have the money? That's not my problem. Your kid's, bent instead of straight? So sorry about that. In Holland, which is somewhat ahead of us, worryingly, there has been something of a social shift towards the idea that a minimally dysregulated, different person is a private matter. It's not a government issue anymore. And there are people in this country who will tell you they're ready for that now. It's too expensive. And there are other people who will tell you, with much less logic to it, I made this money and I'm not paying it in taxes anymore. So we have a really worrying moment here. So we heard over and over again, fee-for-service is dead. The narrative here is that New York State has had a wasteful, indulgent, legacy system in which people get their passport stamped, they're in for life, and that's done, and the rest of us are paying for it. I happen to think there's a different narrative. I happen to feel very proud of having people like Arthur's here because I think that they've helped shape a system of care that's among the best in the world. Stephen mentioned that when he began this conference yesterday. So there are two narratives at war here, and at the moment, the narrative of generosity and pride and an expansive, capacious definition of commonwealth and society and value is losing ground to another one. We can win if we come through this with a new system of care that is intelligent, thoughtful, cost-effective, and human. So we as parents, if I can speak, although who could speak for Margaret and Ellie? They're very articulate. If I can speak on behalf of all of us, we're counting on people like you to show that this can be done well, intelligently, without loss to human beings and to families. It's a privilege to be part of this day. Thank you.